Diagnosis and treatment. Index 1. Introduction to medical diagnosis. 1.1. General components. 1.2. History. 2. Specific methods. 2.1. Parts tests. 2.2. Medical imaging. 2.3. Biopsy. 2.4. Surgery. 3. Pharmaceutical development of new drugs. 3.1. Development procedure. 3.2. Generic drugs. Medical diagnosis. Medical diagnosis refers to both the process of attempting to identify a possible disease or disorder, diagnostic procedure, and to the opinion reached by this process, diagnostic opinion. General components. Physical examination. Diagnostic tests, medical tests performed to aid in the diagnosis or detection of disease. Processing of the answers, findings or other results. History. Methods of diagnosis changed massively during the 19th century. Linek, 1816, invented the stethoscope and started the practice of auscultation. Pierre Louis, 1834, started making diagnoses on the basis of a full clinical examination of the signs by the disease. Carrouge, 1878, developed the technique of biopsy, removing cells to determine if they were cancerous. Doctors started to use machines. Carl Ludwig invented the chemograph, which measured the pulse. Wilhelm Röntgen discovered X-rays. Willem Einthoven invented the electrocardiogram, which measures heart activity. Specific methods. Medical imaging. Definition. Medical imaging is the technique and process used to create images of the human body for clinical purposes, medical procedures seeking to reveal, diagnose, or examine disease or medical science. It uses the imaging technologies of X-ray radiography, magnetic resonance imaging, medical ultrasonography or ultrasound, endoscopy and nuclear medicine. Specific methods. Biopsy. Definition. A biopsy is a sample of tissue taken from the body in order to examine it more closely, when an area of tissue in the body isn't normal, to remove cells to determine if they were cancerous. Specific methods. Surgery. It's a medical specialty that uses operative manual and instrumental techniques on a patient to investigate and/or treat a pathological condition such as disease or injury, or to help improve bodily function or appearance. Stages. Location, environment and procedures. Preoperative preparation, examination. Staging for surgery, confirmation and preparation. Surgery. Postoperative care, recovery. Pharmaceutical development. Development procedure. Preclinical work. New chemical entities, NCE, emerge from the process of drug discovery. It is the function of drug development to assess all the parameters prior to human clinical trials. A further major objective of drug development is to make a recommendation of the dose and schedule. It will be further examined for its suitability to be made into capsules, tablets, aerosol, intramuscular injectable, subcutaneous injectable, or intravenous formulations. Clinical phases. Phase I trials, usually in healthy volunteers, determine safety and dosing. Phase II trials are used to get an initial reading of efficacy. Phase III are large, pivotal trials to determine safety and efficacy in sufficiently large numbers of patients. Phase IV, these are conditional post-approval trials. Pharmaceutical development. Generic drugs. When a pharmaceutical company first markets a drug, it is usually under a patent that allows only the pharmaceutical company that developed the drug to sell it. Generic drugs can be legally produced for drugs where the patent has expired. The generic company certifies the brand company's patents are invalid. for drugs which have never held patents. In countries where a patent isn't in force, pharmaceutical development